The role of the ICC is one of the most critical positions, I would argue, within the dental office. This individual is responsible for implementing and overseeing your infection control protocols, ensuring compliance with regulations, and safeguarding the health and safety of not just our patients, but us, the team members, the people we work with. And if we take the IFUs for our autoclaves, for instance, it's going to tell us some important information, and they are not all the same. If you looked at your hand pieces, you could have a slow speed hand piece and your Cavitron and let's say your high speed hand piece all going into the same cycle. But if you look at it, maybe they have different temperatures, they have different sterilization times, different drying times, which is a little bit frustrating. So I encourage you guys to look at your IFUs, but it's going to be overwhelming if you haven't done this before to look at them all at one time. So I say take an IFU a day just to audit and see if you're actually doing all the directions. Cleaning ensures the removal of all of that visible debris like your blood, your saliva, tissue residue, all the things that we might find on our dental instruments, right? These contaminants harbor microorganisms like bacteria, viruses, fungi, which can compromise the effectiveness of the sterilization process. Furthermore, effective cleaning of dental instruments helps to maintain their lifespan and their functionality. If you have an autoclave that allows the dry cycle, it pops it open and you can actually get into that autoclave to get those instruments while it's drying, we have all done it. We've all pulled those instruments out. We're waiting. We need that one cassette, that one tool, whatever it is. But drying is a part of the sterilization cycle. Now I work with an autoclave that the door stays sealed through the entire process, and that has helped our work practice controls. And if you are not familiar with what work practice controls are in the infection control space, essentially those are the behaviors that we all do. So you can have all the equipment and all the cool things, all the engineering controls, all the sterilization equipment, but if you are not actually doing it properly, we don't have good work practice or admin controls, then obviously we're not going to be super successful. The aerosols that we live in dentistry, the stuff that are on the clean side of the counter, when we take those instruments out and we put them on the counters and they're sitting out there to dry, that wicking is going to pull that bacteria from the air, from the counter, and go into that material. And that means, y'all, your equipment, your instruments are no longer sterile. So you just went through that whole process, and if they come out wet, they come out damp, and they get set aside, then that is an issue for the overall sterility and long-term use of these instruments. And I highly, highly encourage you to have a standard operating procedure written out for your spore testing, because there are ones that are mail-in, and then there's some that are in office. I prefer in office, and now there are so many in office options. There's even ones that are happening, you can get the results within 20 minutes, which is so cool, even an hour. That at least tells me I could do that in the first thing in the morning, figure out if my sterilizer is working properly, and feel happy and secure that all the instruments going through that sterilizer for the rest of the week should work and be safe to use on patients. This is one, an in-office spore testing, if nobody has seen it, because I'm actually surprised how many people do use mail-in. And it's pretty easy. You have your spores, they incubate. This is the 20-minute guy. And so I'm going to get my results super fast, which is fabulous.